And we have started the recording also. Very
Okay, we are
good
live now.
evening, sir, to be
Oh.
on the show. Dr. Sanjib Dutta for everyone. And I will ask sir to introduce himself because he has such a long list of acclamation
Yeah,
that it's better if sir introduces himself.
good evening, everyone. Here, I'm really delighted and excited to be here with Nilanjana Rambothu, madam, on a very important topic like the challenges in during puberty, especially in relation to our neurodiverse children, like suffering from autism and all. And I did work in the field of adolescent gynecology also in our state body, as well as presently I am working as an associate professor obstetrics and gynecology in College of Medicine and Sagore Dutta Hospital. There we see a few number of patients as well who are actually suffering from this kind of neurodiverse situations and some challenging situations. So along with some normal patients, we also cater this kind of children where the parents are actually accompanying them with some kind of problems, where the problems may not be that important, but they are giving much importance to it. And sometimes the reverse is also true. They are not giving enough importance to the actual problem that is actually there. So with this little introduction, we can go straight into the topic of this thing,
Absolutely.
puberty and challenging situations that can happen in autism and neurodiversity.
Absolutely. Now, we will be very clear about a lot of things today. Sir will be talking in Bengali and English. And किसी को अगर चाहिए हिंदी में, मैं उसका
No, I can
translation कर
manage
दूंगी.
Hindi as well.
Of course,
Little.
sir.
Yeah.
But I don't want you to distract, I want you to be there. And what we are going to talk about is really a very taboo subject and very difficult to talk in an open forum. But we are bringing this subject because this is the need of the hour. Because this gynae problem in neurodiverse children is really something we have to think about, because medical issues, immunity, lot of things are really very important to talk about.
Yeah.
So, sir, first thing, I think the very first thing we need to understand what is puberty and what is adolescence.
Yeah.
We want a very clear picture on that.
Yeah,
I think parents
truly.
need to understand that more.
Yeah, truly. Puberty is something like, I mean, if I go by the short definition, that it is the navigation from sexual immaturity to sexual maturity. And it usually involves the development of secondary sexual characters, and we will go into it little bit in detail later. And along with that, some psychological maturity, psychosocial maturity. Okay, so that is actually what we call as puberty. And adolescence is usually a long range of years that usually starts with puberty. Okay, so puberty usually starts at around, say, 9 years of age. And similarly, adolescence also starts around 9 years of age. But usually, adolescence includes the whole span of puberty that exists from 9 years to maybe 14, 15 years, and then again go beyond it up to the age of 18 years. We call it the whole from 9 years to maybe 18, 19 years. We call it the adolescence, because during that period, along with all the puberty changes, some additional things happens, because there are some psychosexual maturity, there is some abstract thinking ability, there is some transition from childhood to adulthood. So therefore, adolescence usually comprises of long many years compared to the puberty that happens from 9 to 14 years. So adolescence involves from 9 years to, say, 18 years. Okay, so and adolescence starts from puberty itself. So that is the difference between puberty and adolescence. Almost similar, but adolescence usually involves much more years, and that ends with sexual and psychosexual and psychological maturity that comes with puberty changes.
Absolutely.
Yeah.
There are, if I segregate, like we were talking beforehand, we plan to do this. I had told you that for 18 to 19 years, I've collected so many data where certain patterns are very obvious. So,
Yeah.
in that category, if we bifurcate three zones of age, that is from 3 to 5, from 6 to 9, and afterwards, there
Yeah.
are certain changes in a child's body, especially the girls, they start early puberty, as everybody knows. But
Yes.
we have seen that when they are at the age of, 3 to 4, or at the most 5, children do certain behaviors, which is in psychological term, we call it childhood masturbation, right?
Yeah.
But it is not sexual as we understand and we have studied. It's more like you said, psychosexual stages and sociological things where the child doesn't know how to handle the
This
inward
situation. Yeah.
stimulatory.
Yeah.
So can that be one of the aspect of regression also?
Yes. Basically, these are the age that you have mentioned, that is in the pre-pubertal age. So,
Yes.
in this age group, we have seen few actually children, they are suffering from some kind of abnormal behavior. You can put it like that, abnormal behavior, like touching the genitalia or rubbing the genitalia with the bed. And actually, the psychosocial circumstances is like that only, because these kind of children usually they mostly spend their time with their mothers. They usually touch their mothers everywhere, and they don't know how to behave properly, and automatically the stimulation comes from inside. And uh, I don't tell it a sexual one, that you already said that it is not a sexual behavior, but it is one kind of a abnormal behavior that should not happen at this early age. And the thing is, what we can do about it? Okay. So here comes the role of an educator like you, role of an trainer like you, because we can go by some technology which is suitable for them, because we know that all our children are different. Okay.
Yes.
They used to adapt to different kind of teaching and learning methods. Not one single method is applicable to everyone. So it may be in some children, it may be required for a low tech technology like PECs and all. In some children, you may go about high tech one like AVAJ and all, which is you are a master of it. Okay, so and it is to be understood by the parents that this kind of behavior is not at all abnormal one. Okay, it
It
happens, and it
happens.
actually goes away. And you need to buy some time for that. You need to make your children understand that this is not kind of a right behavior. I mean, you make your children learn that what is a good behavior, what is bad behavior, what is a public behavior, I mean, what is a public and private one. Okay, so what are the things that can be done in public, and what are the things that are allowed in public, and what are the things that cannot be done in public. If that kind of things happens in public, then what will be your behavior to circumvent that? Okay, right.
Sure.
Just like if something is happening in your common space where many people are there, then the common teaching would be you go away from that space and you go inside and you prepare yourself and then come back. That kind of thing. Okay,
The
so that is
private
the
time.
way we can go about it.
Yeah, the
But
private time.
overall, this kind of things doesn't require any treatment mostly, and usually this goes away over a period of few months maybe. And the thing is that if that persists for a long time, then you need to understand whether this baby is suffering from any kind of stress, any kind of some aberrant thinking, any kind of some stressful situations that is coming from outside, like maybe from schools, maybe from peer groups, maybe from the other family members. Okay, so some kind of abnormal stimulation, whether that is present or not, you need to, I mean, make out all those things and to try to refrain from all those abnormal stimulus, and make the child stress-free and calm and quiet. And overall, in most of the circumstances, doesn't need any treatment for that.
That's something very important you have told. Now let's go to the other age group, the little older ones. Especially here, I'll mention the girls because I have seen. that girls of the age, when their puberty starts,
Yeah.
I think it starts very gradually, and from 3 to 4 months before, they start showing inappropriate behavior and an increased aggression. Okay.
Yes,
There
right.
is a sudden aggressive bapatta chole ashe, and they start scratching and pinching also. The child who was very calm and quiet suddenly starts pinching. So those girls, I think, needs to be prepared. Like in my privacy classes, I keep telling that prepare the girl. But why this increased aggression? Is there any correlation between it?
Yeah, basically, we are talking about mostly the puberty changes that happens in the young girls in the age of maybe 9 years, maybe little earlier than 9 years. It has to be understood that in the girls with neurodiversity, with autism, they used to have the puberty changes at least 1 year or few months earlier than their counterpart, those who are in normalcy. Okay, so and there are some series of changes that usually happens in the body in the young girls. It usually starts with breast budding, and then the next thing that is going to come is the pubic hair. Next, the next thing that is again coming after 2 to 3 years is menstruation. Okay, and along with menstruation and puberty, other pubic hair changes, there is a growth spurt. Okay, that means the child increases in length, so increases in height. So these are the four things that is going to happen in a series of things. Okay, so now the thing is that usually it starts with thelarchy. Thelarchy means the development of breast bud, and
Okay.
that usually starts at around 9 years in normal situations. But in our children suffering from autism, they usually do have all these changes at maybe 1 year earlier. Maybe that happen maybe at 8 years of age. Okay, and the thing is they are actually very much, they become more stressful that what is happening to us. And the problem arises because they don't understand what is happening to them. The problem arises because they don't interpret what we are giving advices to them, and sometimes some misinterpretation and lot of misthinking. Okay, that and they need repetition of all this learning process. So that is the challenges that happens in those small children. Even if you try to make them understand that what is happening to them is absolute normal thing, and you don't have to be worried about it, but it's really a challenge to make them understand that what is happening to them. And these kind of changes in normal situations, the small children, they used to learn a lot from their peers in the school, so but they are deficient in that aspect as well. They are actually depending upon their mothers only or only parents. They are not
Yeah,
learning and hearing anything from their teachers at school. So we call it inclusive school, but I don't know whether actual inclusion, what do you mean by that? But they doesn't learn anything, nothing, no sexual education, no sex education is there
absolutely.
at the inclusive schools as well. So it becomes a challenge to make them understand what is happening to them. And this kind of changes happens because of some hormonal changes, because
Absolutely.
it starts from the brain. It hypothalamus, pituitary, and then ovarian axis. This all those hormones increases in numbers, and then that gets released in a pulsatile manner. So that
Absolutely.
brings up the all the changes in the female body, and this kind of hormonal upsurge, ups and downs, they are basically becomes. I mean, they get confused about what is happening to them, what is under. I mean, what undercurrent is running inside them. Okay, so that is causing problems in this puberty age group to these children
Absolutely.
because of these changes.
Absolutely. Because we are talking about girls, let's finish the girls part also.
Yeah. Mm.
There are certain things about girls. There is a practice which is not openly discussed, but as therapists, we know because a lot of concerns. See, I cannot put it on paper and pen because parents won't
Yeah.
be doing that. But definitely in my certain discussions, privacy discussions where parents open up and they talk about in this 19 years, I've got so many cases where girls of 16, 17 years are ligated. Okay. Now, it can be a controversy in the sense, like we had talked about, but still I'll say that forget about doctors who are doing it, but the parents, what they need to understand, is it ethical? Is it correct with them to decide so? Because some of them go out of the country and do it and come also, that kind of a
Absolutely.
thing.
Yeah. So talking about permanent sterilization, I mean, whenever you are removing all the reasons to become pregnant, so that is a surgical procedure, and one just cannot do it. Okay, it cannot be done in an unmarried woman or adult. Okay, so it is absolutely contraindicated. If it cannot be done in a person whose family is not completed. You cannot actually take decision on their behalf that they are not going to marry, they are not going to have children. Okay, there is no law in favor of that. And one cannot do ligation to a young lady suffering from autism just because they cannot communicate on their behalf. So it is absolutely, I mean, it's a punishable offense, I would say, and one just cannot do it. But from the parents' perspective, they are actually very much worried about
Scared. They're scared.
about their daughters to get pregnant for any reason. I mean, there are some other methods, if they are actually
Exactly.
worried about for all those reasons, there are other methods of avoiding pregnancy. And oral contraceptive pill itself is a very safe method for avoiding pregnancy, as well as these are also safe in this kind of children where there are some menstrual irregularities, the children suffering from polycystic ovarian disease. A lot of patients, a lot of girls in autism ASD spectrum, they have polycystic ovarian disease, they have some menstrual irregularities, they have some profuse menstruation during periods. So all these kind of things can be addressed by giving only simple oral contraceptive pill. But again, the challenge is to give some tablets every day, I mean, at a proper time. So that is always there. But obviously, ligation cannot be a alternative to all those
Thank you
temporary
for that
methods.
information.
Mm.
Now, with contraceptive pill, as far as I have also used after Rahul, so I think that reduces the pain factor also during yeah, period time, je
Exactly,
pain ta hoy,
exactly.
ovulation
Mm,
time mein
mm,
pain hoy.
mm.
I think contraceptive pills reduces the pain also.
And that is very important because lot of things that happens during puberty, and they cannot express themselves. So maybe it's some kind of I mean some kind of problems happening in the uterus because of pain. They are getting irritated, they are becoming restless, they are causing a lot of abnormal sounds and other things, restlessness going here and there. Okay, so that all those things may be because of the pain itself, because of the menstruation, because of the some discomfort that is happening in the lower part of the abdomen, and sometimes urinary tract infection. Okay, so whenever a small girl is actually having their periods, it cannot be ignored that many things that is there during the menstruation that happens, so that has to be addressed properly. Just if you give oral contraceptive pill, that will take care of our periods on a regular basis, and then it will reduce the amount of bleeding, then it will reduce the pain factor, as you correctly mentioned. Okay, so one single tablet will give a lot of benefits. Okay, so it is absolutely safe. And obviously, in those children, if it is required, I am not actually supporting giving medicine for any reason. But if it is a real problem, then it has to be managed like that. It has to be managed in a medical manner. Otherwise, small amount of pain that is or normal menstruation, it is well managed during these periods. Okay, but the
Hmm.
thing is that you need to make this kind of children, make them understand that that is what is going to happen next. So whenever there is development of breast budding, it has to be understood that the menstruation is going to happen in next 2 to 3 years time. Okay,
Okay.
so it is a good practice that if the parents or if the mother can teach them how to wear bras before the development of breast buds, or maybe when it is actually occurring, and even they should train their children how to use pads even
Mm.
before onset of menstruation. Okay,
Absolutely.
so that
Absolutely.
they can use it in a proper way, and they can have the habit of using it, and how they can use it in a private manner, how they will throw it away, and whenever there is any problem, they should ask their they should come to their parents and then ask for help. So that kind of phenomenon has to be taught to them even before the symptoms arises. So then only whenever the problem arises, then they are well trained and they will manage themselves in a proper way.
Absolutely. And I think the most important is if the pain factor is less and it is timely scheduled, a child gets the predictability, তাহলে অনেক শান্ত
Yes,
থাকবে মানে I think
definitely.
easing out their life is more of a priority than putting things on their head where they don't even know what to do next.
Once they are
So
used to it, having regular menstruation at a proper phase of time, then obviously it will be a regular phenomenon, and they will be used to it, and they will not
yes,
show their aggression and irritative behaviors whenever that is happening.
absolutely. Here, two more questions are there. একটা হলো, if any child is having antipsychotic drugs like Cisdon, Risperidone, does that interfere with contraceptive pill taking or is it
Usually,
separate?
it depends upon the dose of the drugs, as well as at how many duration of time they are actually taking this. But most of the time, oral contraceptive pill efficacy is not reduced by using all those drugs. Okay,
Okay,
and there are few other drugs which can interfere in the uses of oral contraceptive pill. But as a whole, the doses which are given to these children for taking care of their irritability and ADHD, or whatever the reason for which they are using it. So that usually doesn't cause much of a problem when they are also using oral contraceptive pill.
okay. Then that clear. But it's better both the doctors because both the
But
medicines are
obviously,
not going
yeah,
to be
yeah, yeah.
prescribed by one doctor.
It's a multidisciplinary approach, you can say.
Absolutely.
So whenever any kind of things that is not actually a normalcy, then obviously they should contact to for their gynecological problem. We are there for the psychological and other aspects. The psychiatrist has to be involved like that, and some all these behavioral issues you people are there. So it has to be a multidisciplinary approach, but it has to be understood by the parents that what is normal and what is actually deviating from the normalcy. Okay.
Absolutely.
And in the initial years, after the onset of menstruation, in the initial 2 years, usually there are some menstrual irregularities in that happens in every woman, every small girl. So
Mm.
after the onset of menstruation, in the initial 2 years of menstruation, usually they don't require any treatment. So don't get confused about what is happening to them in the initial 2 years of menstruation. Usually your body takes 2 years time, 2 to 3 years time for the normal axis of hormones to fall in line. Okay, so then the menstruation will become regular on a regular pattern. So therefore, in the initial 2 years, unless there is a major severities uh, like suppose menstruation is happening every 3 to 4 months, or there is huge profuse bleeding which requires treatment, unless this kind of things happening, usually in the initial 2 years, no treatment is recommended. Okay, so it has to be understood by our parents that in the initial 2 years, unless a major problem arises, we are not going to give any medicine for any menstrual irregularities. Okay, so
Okay.
oral contraceptive pill, what we were talking before, usually that are given after the initial 2 to 3 years of menstruation, after the normal waiting time.
Okay. That goes the onset. What about the menopause?
Uh, you mean what will
There
happen
are a
during?
lot of girls, if menopause, I can understand at this age that how
Hmm.
troublesome it is. So for
Yes.
our neurodiverse girls, I mean ladies, that will be really very tough time, right? What they can do. I
Yeah,
mean,
usually what happens, menopause and puberty, those who are having early puberty, they usually do have late menopause. Okay, and
अच्छा उल्टा.
when उल्टा होता है, तो
Okay.
वो पहले आ जाएगा तो वो बाद में जाएगा। ठीक है, तो when it is early puberty, then there will be late menopause, and usually our children usually do have early puberty, premature puberty, and there is a possibility that they will be having menstruation little longer than their counterpart. Okay, but the problem is, even in a normal situation in the common population, our ladies usually don't come to us. Very few ladies used to come to us for their menstrual problems, for their menopausal symptoms. Okay, they used to suffer, but they absorb it, and they don't come to us for treatment, which should not be done, because many things are there, like hormone replacement therapy. Like, these are actually required in special circumstances where there is early menopause, where there is some menopausal symptoms. Okay, unless there is a menopausal symptoms, or the menopause happens slowly and steadily, then usually most of the time there is no treatment required. But in older ladies who are suffering from autism, or who cannot express themselves, for them giving any hormone replacement therapy will be a little bit challenging, because hormone replacement therapy requires a lot of monitoring, and because some side effects are there, you need a proper examination of the breast, examination of the cervix at an interval, and there are few side effects as well. So giving hormone replacement therapy will be little bit challenging to them, where the autistic older girls are older ladies, they are approaching menopause. But as a whole, if menopause is too early, okay, suppose it is happening less than 40 years of age, for any reason it happens, because they don't have any kind of stimulation, they don't have childbearing and many other things that usually do happen in a normal circumstances.
Okay.
So they
Okay.
always suffer from some kind of suppression. So it may happen that some of them are actually suffering from early menopause.
Oh God.
So both of the things are possible in those ladies. So in those cases, some hormone replacement therapy would be beneficial, but that has to be given under the guidance of a gynecologist.
And
Okay.
highly monitored.
And few things you can always give, like you can give calcium, you can give some hormone replacement. I mean, not hormone replacement, some multivitamins. Okay, and the correction of anemia. These are something which are required, because they don't take meal in a proper way. They used to suffer from anemia, so this correction of anemia, osteoporosis. These are the things that you can always give. But whenever we talk about hormone replacement therapy, so that has to be given judiciously.
I know there are many questions related to it, but time is short. So now I'll shift to boys. Boys and girls, this is again a pattern I have seen, which really makes me very curious. I've seen that onset of puberty, many children get seizure, epileptic attack. Is it related? I mean, does that
Uh,
trigger and aggravates the situation?
First of all, if they are having any kind of abnormal movement, okay, so it is sometimes becomes difficult to understand whether that abnormal movement because of the puberty changes or because of the seizure activity. So whenever there is any kind of convulsion or seizure-like activity, it has to be understood that whether this is actually a seizure. But this again come in the domain of neuromedicine people. Okay,
Neuromedicines.
so they will be doing EEG and maybe MRI brain and all. So then it will be possible to diagnose whether it was actually a seizure activity. But some kind of abnormal body movement, they actually mimic like seizure, but they may not be a seizure.
Hmm.
Okay,
Hmm.
so but puberty itself is a very stressful condition for our children because of this hormonal upsurge and downsurge and all. And so therefore, during this puberty, there are a lot of irritable behavior, a lot of restlessness, lot of agitated behavior. Okay, so sometimes they mimic like seizure activity. But it is not actually directly related to puberty. It may happen
Okay.
at any point of time. Mostly we have seen people are suffering from seizure activity at the middle of puberty, like 12, 13 years, 14 years in this time zone. But in the earlier period, pre-puberty, in those period, whatever I have seen or I understand, that I mean, this kind of seizure activity is little less, but it may happen because of this lots of stimulation that is going inside, and lots of I mean, they cannot understand what is happening to them, because many things happens because of the stress itself. So because of the stressful situations, they sometimes behave in a aberrant manner, and that may mimic like seizure, and that may be a seizure as well. So again, it will come in the domain of neuromedicine people.
So this is something we really require to dig in and talk
Yeah.
about, research, so many things. I think is so much required in this
Madam, how
field.
much you have seen that this kind of seizure or abnormal activity happening in those age group, 5, 6 years, 7 years, you have seen, no?
I'll give you
Okay.
the datas.
Because you are actually catering all those children a lot more than me. Okay, so it is very common for you to find many other things as well.
Yeah, because I run a parent empowerment na, where
Yeah,
parents
yeah,
are
yeah. Mhm.
supposed to talk up, open up. I
Right.
encourage them not to be in the dark, address your problem.
Mm.
And today's parents are opening up. আগেকার আমাদের টাইমে আমরা সাহস পেতাম না এত প্রশ্ন করার।
Yeah,
And
right.
of course, you, Dr. Rudro, Joshodhara, you people are so accessible. It makes us easier for therapists. See, therapist is not clinical. I'm not a clinical person. It's my curiosity that makes me study more, understand, I collect data. So I've seen patterns. So I want to, clear those patterns. So I'm so thankful that you people come forward to help us out. It's so necessary. Parents need an answer because আমাদের এই ফিল্ডে না proper answer নেই, guidance নেই. So parents sometimes get into wrong things like যেটা আমরা শুরুতেই
So
বললাম.
this field, a lot of things which are less understandable. Even the doctors for us also, uh, all are related to neurotransmitters, all are related to epinephrine, norepinephrine, serotonin, and many other things. Even in the subject of psychiatry as well, many drugs are little less understood. What
Absolutely.
drug will actually work for a particular children, even the psychiatrist doesn't know as well at the very beginning. They usually
Yeah,
give a try and then see what happens to them, because all are related to neurotransmitters that is happening inside their brain. It is very tough to understand what drug will actually act at particular neurotransmitter level. It is very difficult.
absolutely. And what reactions, the interoception of everything, how your body, how your mind, everything is going to react to a
Yeah.
certain factor, which is not common in everyone. That's why
Mm.
it's spectrum. So
Right.
that is there. And another thing in boys is uh, that can be any reason. I'm not talking about the reason, but একটা increased aggression চলে আসে boys দের মধ্যে. And that the pattern, I'm not sure, but this is what I've seen as a pattern. See, science is all but collecting data and evaluating and creating a strategy. So what I have evaluated can be wrong also, because I'm seeing a pattern. সেখানে না একটা জিনিস দেখেছি, children who cannot uh, address their sexual stimulation at adolescence, and parents are not helping or blocking or doing, many parents give medicines to stop that stimulation and all. I've seen those children have a burst of aggression. So is it correct, or a lot of parents don't, I'll say fathers, because for boys it's fathers, for
No, it is
girls,
understandable
the
what you mean.
masturbation part is so tabooed word. So
Hmm.
does it help? Because a lot of parents say that teaching masturbation to your child is harmful.
No, not at all. Basically, I mean, this masturbation and nocturnal emission, okay? So these are absolutely normal. Even that starts from the very beginning of puberty. Even small child, like 3 years, 4 years, they also actually can have masturbatory activity, that you call it by childhood masturbation, okay? So that is in different form, like rubbing or touching the genitalia, this kind of thing. But in older children, masturbation comes in a different way. And whenever that is happening, we need to make our children understand that what is meant by it. So we need to make them understand that this is absolutely a normal behavior, and you don't have to be worried about it. But the point which is very important is whether there's something which has to be done in public or it is in a private manner. Okay, so something has to be told to them that don't undress in public, don't touch your genitalia in public, don't expose yourself in public in any form, don't do any kind of rubbing activity, don't sit on a lap in a public place. So this kind of advices has to be given. Even if you go on telling repeatedly something to our children, they will learn at some point of time, I'm sure about it. And the point which is very important, which is public or private affair, and what if something is happening to them, what they will do. So suppose you need to we need to actually teach our children that whenever if there is undue erection, because they sometimes they do have erection at any point of time, okay, without any stimulation. So, and if that happens in a public place, so what they will do. So we need to make them understand that please go away from the public place and go inside your room, and you adjust in your room, then you come back after some time. Okay, so that is the way we can teach about it. Suppose if there is nocturnal emission, then it has to be the information has to be percolated to our children that it is absolutely normal thing. If that kind of things happens, then you come to us, then you tell us to change your sheet, isn't it? You tell us to change your dresses. So that is the way we can advise to them, just ignoring the part that this is an abnormalcy and this is not actually an accepted thing to happen in anywhere. Okay, so we need to try to make them understand that this is absolutely a normal thing, and whenever this kind of things happens, what are the things that has to be done, and if there is emissions or ejaculations or that kind of thing, you need to repeat, come back quickly to inside the room and change the dress. So that is the way you can talk about it. And obviously, no way to, tell them that this is an abnormal behavior or that kind of thing.
So, it is quite obvious that masturbation is not unhealthy if it taught in a proper way, and
Exactly.
it's going to solve a lot of problem because of course when they learn to handle their stimulation inside the body, there will be more calm thing, and it's quite natural, right? They cannot get married as most parents want their children to, but I think solving one of the problem of sexual stimulation is going to be a relief to them.
No,
Okay.
sexual stimulation is absolutely normal, and that is actually going to help the children because they will release their emotions. They will be more settled in their atmosphere if they can do it in a private manner, isn't it?
Absolutely. That was wonderful talking to you. And I mean, I am full of load of more questions, but time is short. And taking your time from busy schedule, and like I call Dr. Rudro a healer, I'm calling you a healer too. So, it's so important that we are talking about a subject which
This is
needs to
again
be
a
addressed.
learning curve for us as well. We are learning from these children every day and night. You know?
Absolutely. They are
Yeah.
teacher. They are the best teacher to teach us. There are so many things as doctor, as therapist, we have to know, we have to understand. And with my son growing up, now he's 21-year-old, I've learned a lot. There are
My son
certain
is only
medical,
13 years in the spectrum, as I said.
yes,
So from
yes.
the parents' perspective, a lot more things are due for me to do in the subsequent years.
Yeah, that way I can advise you also, being a
Yeah,
mother
yeah,
of a
yeah.
older
Truly,
son.
truly.
Yeah, medical things are there, like, children who suffer otitis, like my son also suffered. There are certain medical issues related with this. Maybe we'll do another episode on that with
And
your due time taken.
just one point.
Mm,
Whenever a child touches genitalia or rubs it, so you need to understand that few other things can also happen, like whether there is any pain in the genitalia, whether there is any urinary tract infection, or whether there is any psychological ups and downs that is happening at that point of time. So these are the things again has to be addressed properly.
absolutely.
Not actually ignoring everything all throughout.
Absolutely. Absolutely. Those questions I will prepare for you to answer again.
Yeah, most welcome.
So that was wonderful. And let's all thanks Dr. Sanjib Dutta for this wonderful session where I think এত আরাম সে বোধহয় আমরা কেউ এই ব্যাপারগুলো নিয়ে বলি না, and he made me feel very comfortable talking about this because we had three more discussion before we came over here, because the subject could
Yes.
have been a trolled one also. Thank you so much,
Right.
Dr. Sanjeev. And
Thank you, madam, for making this happen. Actually, this is all a different kind of thing. We really discuss very less about it, and
absolutely,
I'm really looking forward to discuss more about it in near
absolutely,
future. Thank you, your
absolutely,
team and Sachetna and the people who are also involved with all your works and all. I
absolutely,
definitely
absolutely,
congratulate all of you.
absolutely. Thank
Thank you.
you and good night. Take care,
Good
all of
night.
you.
Thank you.